One tiny mite can destroy your sleep, and one cream can kill it completely. Today, you'll understand exactly how permethrin works and how to use it safely. Hello everyone. Welcome back to the channel. In today's video, we will discuss the pharmacology of permethrin, a commonly used topical medication for scabies and head lice. What is scabies? Scabies is a highly contagious skin infection caused by tiny mites called Sarcoptes scabii. These mites burrow into the skin and cause severe itching, redness, small bumps, symptoms that get worse at night. Scabies mainly affects skin folds, such as between fingers, wrists, armpits, waistline. In infants, it may also affect the soles of the feet. What is permethrin? Permethrin is a synthetic pyrethroid used as a topical antiparasitic drug. It is available in different strengths. 5% cream for scabies, 1% lotion for head lice. Permethrin kills adult mites, nymphs, eggs, nits. Head lice explained. Pediculosis capitis. Head lice spread through head-to-head contact, sharing combs, pillows, bedding, hats, and scarves. An adult louse lays 8 to 10 eggs per day. These eggs are called nits. Nits stick firmly to hair roots, are oval and light brown or white, are commonly found behind the ears and neck. After 8 days, nits hatch into nymphs. After another 8 days, they become adult lice. This causes severe itching, scratching, irritability, sleep disturbance. Mechanism of action. How permethrin works. Permethrin is a neurotoxin for parasites. It works by blocking voltage-gated sodium channels in nerve cells, preventing nerve signal transmission, causing muscle paralysis, leading to respiratory failure and death of the parasite. This action kills adult mites, nymphs, developing eggs. How to use permethrin for scabies. Use 5% permethrin cream. Apply to entire body from head to toe. Focus on skin folds and hairy areas. Avoid eyes, mouth, and nose. In elderly patients, apply to forehead, temples, hairline. Leave on for 8 to 14 hours, usually overnight. Wash off with water. Repeat after 7 days if needed. How to use permethrin for head lice. Use 1% permethrin lotion. Steps. Wash hair with shampoo, no conditioner. Dry hair. Apply lotion to scalp and hair. Focus on behind ears, nape of neck. Leave for 10 minutes only. Rinse thoroughly. Do not use conditioner after treatment. Why? Because permethrin leaves a residual layer that keeps killing newly hatched nymphs for 8 days. After washing, comb hair with a nit comb. Repeat treatment after 10 days if needed. Prevent reinfestation. Wash clothes, towels, and bed sheets in hot water. Dry thoroughly. Clean combs and brushes. Avoid sharing beds, pillows, hats, scarves. Treat close family members if needed. Precautions. Avoid eyes, nose, and mouth. Do not swallow. Avoid use in pregnancy. Do not use in infants under 2 months. Use cautiously in asthma patients. Side effects. Common side effects include skin irritation, redness, swelling, dryness, mild burning or itching, rarely, allergic rash, breathing difficulty in asthmatic patients. Chemical class. Permethrin is a synthetic pyrethroid, a cyclopropane carboxylate ester, structurally related to natural pyrethrins. Permethrin treats scabies and head lice. 5% for scabies, 1% for head lice. Works by paralyzing parasites. Safe, effective, and widely used. Thank you for watching. Don't forget to like, subscribe, and share. Stay tuned for another medical video. Take care.